let's talk about wisdom teeth. Why do they always give so many problems? Well, there's usually 3 reasons. 1, the space available around the area to keep it clean. 2, usually when they come through, sometimes the gum covers the entire wisdom tooth, sometimes it partially covers the wisdom tooth. And 3, the angulation to which the wisdom teeth is coming through. Sometimes they come through at all different types of angles. Usually when the wisdom teeth come through, there's limited space in that area. So this means that plaque and bacteria tend to stagnate in those areas, and that can cause issues with the gum, bad breath, as well as dental decay. The gum coverage. When the wisdom teeth are coming through, the gums do not always completely cover the tooth. Sometimes you'll find that either they partially cover the teeth and the gums can get a little bit slack. So sometimes plaque can go in and hide underneath that slack or loose bit of gum, and then it can cause issues with an inflammation or even an infection. The position of the tooth. Now, as I said, you can get different angulations of the wisdom tooth. Sometimes they're lying down at an angle, sometimes they turn to the side, and the area in which they are connecting with the tooth in front of it can cause plaque and food to get trapped in between, which makes it very difficult to clean. So I'm going to give you some solution. First thing you need to do is go and visit your dentist. Usually what we could do is take a panoramic x-ray to get a full view of what's happening underneath the gums. And that way we'd be able to assess the wisdom teeth to see if we would recommend having the teeth removed. The second thing I need to stress is that your oral hygiene has to be top notch. That means using an electric toothbrush, a water flosser. Now, I usually recommend to use a water flosser in conjunction with manual floss. Now, the manual floss that I love is the cocoa floss because that actually has a spongy bit that when you use it, it actually removes a lot of the plaque that gets caught in between the teeth. The third thing is to use a tongue scraper. When you use a tongue scraper, you actually remove the majority of the bacteria that lives in the mouth, and it reduces the bacterial load inside of the oral cavity. Number 4, you can use a fluoride mouthwash. I usually recommend to avoid the mouthwashes that contain alcohol. So you can get a fluoride alcohol-free mouthwash. If you are using an electric toothbrush, make sure you're using one that has a small head, because that small head of the electric toothbrush attachment can really go in and get into those crevices where it's really difficult to remove the plaque from those areas. Most of the times when we're brushing, we open really wide. One of the tips I can give you is to get the toothbrush in there and actually close the mouth, and that way you loosen the muscle of the cheek so you can have lots more area to get the brush in there and give it a really good clean. Finally, and this is my favorite, make sure you get your regular dental cleanings. When you get a dental clean, we're able to see everything that's around the teeth and the gums. We're able to remove it and make sure that we maintain that healthy environment for your wisdom teeth.